The professed intentions have been generous, the praise lavish.
You are on the front line in this battle.
Working night and day.
Thank you to all of those putting themselves in harm's way.
The work that you do.
An extraordinary contribution.
Risking this deadly virus.
With such love and care and attention.
The cleaners, the cooks, the healthcare workers of every description. Physios, radiographers, pharmacists.
But there has sometimes been a gulf between those famous podiums and the reality for our health and social care workers. Not long ago, the government offered a free visa extension for a year to doctors, nurses and paramedics to recognise their contribution to the coronavirus, efforts to recognise that their lives had been on the line and that they shouldn't have to pay for the privilege of helping to save ours. But ministers didn't offer it to everyone, not to NHS support staff, nor to social carers, despite the fact that their lives had been imperilled as well, arguably at times even more so, and the fact that they are even less able to pay the fees. Some people think that this is unjust and want to see the policy changed. Here's the timeline. On the 31st of March, the Home Secretary announced the visa extension scheme for doctors, nurses and paramedics. On the 29th of April, the Home Secretary expanded the list to 18 further professions. It includes radiographers, midwives, biological scientists, podiatrists, biochemists, paramedics, speech and language therapists, to name but a few. But it doesn't include NHS support staff, nursing assistants, cleaners or porters, or virtually any of those who work in the social care sector. Some of those much more likely to be encountering the virus and who can certainly least afford to pay.
That's what shocked me.
Arun is one of them, a nursing assistant in East London. Originally from India, he, unlike his doctor colleagues, won't be included in the free visa extension.
I'm taking risk of my life and even for my family, and I'm paying so much taxes every month, taking risk for sake of people's lives, saving people's life. Even then, despite all this, paying £6,000 to renew my visa for my whole family, it is really not worth staying here.
Unlike many of those in the exempted professions, Arun has very close contact with COVID patients.
We need to roll the COVID patients every 4 hours. While rolling the patient, he was coughing, and when he vomited, it was on my neck. It went into my eyes. And I can't express how terrified I was, and I had to go down and disinfect myself. We had to face all this every day.
What do you think about when ministers say that you're heroes?
It's like hypocrisy.
Arun isn't alone, far from it. In social care, examples abound of those not included in the scheme. Those we spoke to asked to have their identities protected.
I felt so much disappointed in the first place with the clapping, and again coming into not to be included. I felt so much disappointed. I've never been disappointed like that before, and you can't explain to anybody, because who is going to know what you're going through?
If you are a holder of a Tier 2 general visa, we are not really entitled to any public funds, even a free school meal for our 6-year-old son. So on top of these huge fees that we're paying, we don't get any kind of support at all.
I've been in this country for how many years now, and some people that just came yesterday, and because they are doctors or because they are, nurses, they are exempted, whereby somebody like me, I have my British child, I have my children in this country, and I'm working, paying my tax, the same job. We are doing the same job, and I'm not exempted.
The government says they don't have enough information on social carers to exempt them. They work for manifold organisations, so it's harder to exempt them than NHS staff. But in Parliament there are those even on the government benches who don't agree and have tabled an amendment to next week's immigration bill to include carers and hospital support workers in the scheme.
The government did the right thing. We can have an argument about should it have done it quicker for the NHS visas. So why can we not just apply the same principle in these exceptional circumstances we're in at the moment for those care workers? We've been going out clapping on Thursday night, not just for NHS workers, but for care workers generally, because everybody's appreciated what an important job they all do. So for goodness sake, let's make sure that their position here is safe for the foreseeable future so they can go on doing that crucial job.
Many of those who clean us, wash us, feed us in our frailest days weren't born here, are black or minority ethnic, and often poor. Typically, they're barely noticed. This crisis has changed that, or it's supposed to have done. When these changes are debated in Parliament next week, we'll see to what extent those people are still in view.
Lewis Goodall there. So in response to our findings, the Home Office told us the government is supporting NHS and other eligible health and care workers. In a statement, it added that it had introduced a free one-year visa extension to around 3,000 key frontline health workers, including an exemption to the immigration health surcharge, and had expanded the bereavement scheme to all NHS and social care workers.